Hello everyone. So welcome to my new video. It is about malignant melanoma, means a skin cancer. So it is a skin cancer. We all know that cancer is happening in uh, different parts of our body. So in the skin also cancer is happening. So it is under integumentary system. So in the adult health nursing or MSN nursing, we are described about the malignant melanoma. But before that, I will tell you some rules of adult health nursing. So if we uh, describe any disease, any uh, means treatable disease, we can follow some rules. We will write first about the introduction of the disease, that what is that disease, like that. Then after definition of that disease, then incidence means where it is happening or in which part it is happening. Then etiology. Etiology means the cause of the disease, means how it is happening. Okay. Then the risk factors uh, means how can it will happening. Okay. Then pathophysiology means from the starting of the disease, what are the changing of that particular part is happening, is the pathophysiology. Then clinical manifestation means signs and symptoms, that what are the changes we are observing, or what are the changes is happening in the patient. Then types of that disease, if it is types are there, then types, or if it is stages are there, then the stages. Then diagnosis evolution means what are the uh, treatment we will give to cure that disease. Then management. Under the management we have three types: medical management, surgical management, and nursing management. So in that medical management, um, we will discuss about that, how to means how to give uh, tablets. Okay. In the surgical management, some surgeries if it is happening, then in that. And in the nursing management, if the how to care, or how to uh, means how to take care of that patient, of that particular patient, for that only we are discussing. So let's start our uh, journey of the malignant melanoma. I think it will interesting for you. So first, introduction means malignant melanoma is a very serious form of skin cancer. It is a skin cancer, but it is a serious form of skin cancer. It is a cancer of melanocyte. Melanocyte means one uh, one cell is there for our skin color, that is melanocyte. This is the skin cancer for that. So melanocytes are located in the stratum bacilli and produce melanin. Melanin is responsible for the skin color of the individuals. So abnormal growth of melanin cell in the melanocyte means if skin cancer is happening, you all know that cancer is happening about the uncountable spreadation of the cells, or yeah, uncountable spreadation of the cells. It is happening by a cancer cell is happening. So for the definition is malignant melanoma is the most dangerous skin cancer developed in the cell called melanocyte. So mainly skin cancer is happening in the melanocyte, means it is the main way for the spreading the cells of cancerous cell. Okay, so melanoma is occurred in adult only, not for the child. Melanoma is occurring in the adult, means who are after 19 years old or 18 years old. For that only melanoma is occurring, means skin cancer, not for the childs. Okay, so be aware about that and be careful about that. So our next is cause or etiology, means how the disease is happening, how it is happening. Okay, so it is exposure to sunlight, means some we are playing in the sunlight, we are some work doing in the sunlight. So continuous getting this sunlight is also dangerous. We know that from this sunlight we can get vitamin D, it's okay, but for it is for 1 to 2 hours, but some people are having work from uh, 5 to 6 hours in the sunlight only. For that only it is very dangerous for them. So exposure to sunlight, personal history of skin cancer. If they are having some history in the skin cancer, means in their home, in their family, if anyone is having that skin cancer, it is spreading, it is genetically spreading by them. So next cause is weak immune system. If anyone's having weak immune system, that is also one cause of the skin cancers. Then fair skin means one if anyone is having fair skin, very bright skin, that is also the one cause of for this skin cancer, means like Anglo Indians having a fair skin. Okay, some Americans are having fair skin, so for that only they are having a chance to get this skin cancer. So next is risk factor, means how it will be coming or how it will be spreading. Okay, so lighter natural skin color, it is also be lighter means a very bright skin. Okay, blue or green eyes, it is also the some risk factor for that getting chance to for the skin cancer. So blonde blonde or red hair, means browny color of the hair, is also some chance to get the skin cancer. A family history of skin cancer, it is the most important, means if anyone is having skin cancer in the family, directly it will affected, it is most chanceable. Older age, it is also, because only adult having the skin cancer, not for the child, only adult having the skin cancer. Okay, so for that also. Then next is pathophysiology, how it how means how is the condition of the skin cancer from the getting, means day one up to the till now, that. So so metastatic melanoma is a disease that occurs when the cancerous cell form the original tumor. Primary tumor get tumors, means tumor having two types, primary and secondary. So in that, in the skin cancer, it is having a primary tumor in the first stage. So metastatic melanoma is a disease that occurs when the cancer cell from the original tumor, it is tumors are like a blisters, it is having like a blisters, so in that blisters they are growing up. So pathophysiology is that melanocyte, then melanocytic aptia, okay, melanocytic aptia, then aptical melanotic hyperplasia. Did you all see aptical melanotic hyperplasia, then radial growth phase melanoma, radial growth phase melanoma, then vertical growth phase melanoma. Radial growth phase and vertical growth phase means radial is like a lateral, means like a straight lateral, and vertical is also straight from the vertically it will spread, growth phase of melanoma. Then metastatic melanoma means it is a like a till now it is happening, means from the first to till now how the cells are coming. Melanocytic aptia, aptical melanocytic hyperphagia, then radial growth phase uh, melanoma, then vertical growth phase melanoma, then metastatic melanoma. It is like a chain structure, one by one, stage by stage it is coming. Then after we will see about the signs and symptoms. Okay, signs and symptoms also known as clinical manifestation. Okay, so in that signs and means it is another name of the signs and symptoms. Okay, so what are the signs and symptoms we can get for the skin cancer is change skin in affected area, means skin color is changed in that affected area, how where the skin means the cancerous cell is affected, in that area skin color is changed. Then skin sources means the blisters are happening in the skin. Then pain in affected part, obviously if blisters are happening then pain is obviously happening for that the part is happening. Okay, redness of affected area, obviously when the blisters are happening redness, pain, itching all are coming in that signs and symptoms. Development of blisters in affected area, I say you that if blisters is happening in that part, skin sources are happening, obviously redness is happening and pain is obviously coming. So next is type or the stages of the malignant melanoma. So in that we are having 4 stages. So stage 0 at the primary stage, in stage 0 melanoma, the malignant tumor is still confined to the upper layer of the skin, means in the skin we have first skin, subcutaneous, dermis. So in that upper layer of the skin it is only affected, means it is just starting, it is not going in the deep, just starting. Okay, in this stage 1, after that in this stage 1, so in that stage 1 melanoma is defined as a melanoma that is up to 2 mm thickness, means at the starting age some point like it is happening, means some it is obviously like a blister, but some point means diameter is very less, but in the stage 1 diameter is 2 mm. 2 mm. Okay, it is a blister, but it is 2 mm. Then in the stage 2, sorry, in the stage 2, the melanoma is defined by tumor thickness and ulceration. Ulceration also happening in that part. If tumor is happening, obviously ulcer is happening, because at first ulcer is happening, then from tumor, then from cancer. Means cancer is the main stage of the uh, all are having first blister, starting from the blister. Okay, so in the third stage, this third stage of melanoma is defined by the level of lymph nodes involved and ulceration. Ulceration is happening in, it is obviously happening because it is skin cancer, means whole skin is involved in that. Whole skin means whole body. So lymph nodes are affected in this third stage, and then ulceration is happening more, means it is developed. In the fourth stage melanoma occurs when the melanoma has spread beyond the original site and religions lymph nodes to more distant area of the body, at which at where the part is happening in the first, that part is, that cell is spreading throughout the body. In the fourth stage, it is the final stage of the skin cancer. So diagnosis evolution means how can we detect that it is the skin cancer, like that. CBC means complete blood count is most important. Chest radiotherapy, MRI, CT scan, biopsy, history taking means if any history is there for the skin cancer, then in that history we can getting. Then physical examination, that how it is happening from head to toe, we can do a physical examination. In that we can detect that it is a skin cancer. So next is the management of the malignant melanoma. First is, I said already that in that management, three stages are there: medical management, surgical management, nursing management. So in that medical management is coming first. In that medical management, we first discuss about the chemotherapy. We can give some cancerous patient to be cured. So chemotherapy, it is an aggressive form of chemical drug therapy meant to destroy rapidly growing cells in the body. It usually used to treat cancer, as cancer cells grow and divide faster than other cells. So cancer cell is growing or developing faster than the other cells. So for that only chemotherapy is used, for reducing that growing of the cells. So next is radiotherapy. Radiation therapy is a cancer treatment that uses high dose of radiation to kill cancer cell and shrink tumors. So radiation therapy is more painful than others because it is a radio, means radiation ray, that is pointed only in the cancer cells to reduce the growth of the cancer cells. Then biological therapy. Biological therapy boosts immune system to help body fight cancers. These therapies improve the body immune system and fight against of cancer. If immune system is low, then it can be chance to get the cancer. So for that only it is therapy to get immune means it is growing the immune system from of the body. So for that also we can reduce the cancer spreading cells. So after the uh, medical management, we will see about the surgical management. Wide excision. Wide excision means simple means to cut off. Surgical excision can be used to treat melanoma and non-melanoma skin cancer. Means the part where the melanocyte is developed, in that we can just cut off that part only. So this is the surgical. This is because the tumor is cut out together with some of the healthy skin around it. Means if there is a healthy skin, if it is not that much affected to the healthy skin, so it is better to remove from that all, means that particular portion where the skin cancer is happening. So the healthy skin is called a margin. Margin is also called the healthy skin. So the reason for taking a margin is to remove any cancer cell that have spread into the surrounding tissues. So any healthy skin, if we take, that is for the surrounding cell that we call as the margin cells. So next is nursing management. To avoid excessive exposure to ultraviolet radiation can reduce the risk of skin cancer. Means we already saw that in the skin in this for the skin cancer, the sunlight is more means play a important role. So in this sunlight, ultraviolet rays are coming. So we can said to the patient not to expose himself in the ultraviolet radiation. So to avoid that, avoiding sunburn, to work in the sun, that is also avoiding. Wearing clothes that protect against this sun, sorry. So that clothes is needed to that, that's a full sleeve, then track pants or jeans full pants are mainly protect from the sun. So using sunscreen with a sun protection. So some creams are there for the sunscreen creams are there to protect from this sun, means that hotness of the sun. So to maintain body ability, that is also uh, nursing management. So our last is complications, means how it is happening. First scarring, then pain, infection of the skin neuritis, lymphoedema, chronic pain, then wound. This is the main chart for this spreading of the skin cancer. So if you like my video, then please subscribe my channel and click the bell icon to get notification in the starting at first. So uh, today's topic is malignant melanoma. We can complete that topic. So in the next video I will discuss about the acne vulgaris, means it is also pimple in the skins. Okay, so thank you for supporting. Thank you. Bye.